Hello, welcome to the Med Center Show. My name is Michael Perlutsky. I'm the Chief Operating Officer for the Jersey City Medical Center. And today we have Dr. Etan Spira joining us, gastroenterologist at the Jersey City Medical Center. Dr. Spira, welcome and thank you.
Thanks for having me.
So to start, to introduce you to our audience, let's talk a bit about you, your background, your training. So take us through that.
Got it. So I grew up in northern New Jersey. I ended up going to college in Pennsylvania at the University of Pennsylvania. From there, I ended up back in New York for med school at NYU. Did 4 years of med school at NYU. From there, I continued at NYU to do my internship and residency in internal medicine. After that, I did a year at NYU as a hospitalist scholar.
And what does that mean, actually? You were a scholar after the medical school?
Yeah, it's a title there. Basically, it's sort of an in-between year in between my residency and my fellowship, where I was a hospitalist at NYU, at Lango Medical Center, and also did some research on the side. So with their hospice program and did a little bit of research.
So what was the research you were doing at the time?
I did GI research at the time. I did GI research into some of the infectious diseases of the GI tract.
Okay.
And from there, I was lucky enough to get a fellowship at Montefiore Medical Center in the Bronx, where I was able to train with some of the preeminent leaders, some of the leaders in the field in gastroenterology. And I did that for 3 years.
And Montefiore is one of the biggest academic medical centers in the country.
Yes, it is all over the Bronx, and it's quite large. Actually, in fellowship, we actually are not in one hospital. We're at 4 hospitals associated with Montefiore.
So it's a big program, a lot of training there.
Yep. There are 12 fellows at a time throughout the program, which makes it one of the larger programs in the country.
Okay.
And then from there, I came back to New Jersey and joined my father's practice and ended up back in Jersey City.
So did you have a choice to stay in New York, or it was predetermined you're coming to Jersey City to join your father?
No, I never felt any pressure from my father.
Yeah.
It was not, I had a choice of going where I wanted to. Obviously, I had family, both my family and my wife's family in this area, and so it was a natural fit.
So your father is also a gastroenterologist?
Yes, he's a gastroenterologist also. He's been practicing out in New Jersey, ever since I can remember.
So there's some history for Dr. Spira in New Jersey and in Jersey City.
Yes, my father grew up in New York, but when he started practicing, he came out to New Jersey. But my mom's family actually is from New Jersey. So my great-great-grandfather was a rabbi at a synagogue in Jersey City.
In Jersey City?
In Jersey City.
Wow, okay.
Don't ask me the name, I don't know at this point.
Yeah.
My mother grew up in Jersey City. She went to school around Journal Square. And my grandfather had a business in Jersey City on Communico Avenue, an Army-Navy surplus.
Army-Navy, so from Army-Navy surplus to GI practice in Jersey City.
Yes, exactly. And as growing up, by the time I was a child, he had moved to Bayonne, but I visited my grandfather all the time. He lived on a place on Kennedy Avenue. Used to go to the park with him right across the street. So been in Jersey City a long time. Jersey City area a long time.
Sure, that's a full circle for you. So you went to school in Pennsylvania, trained in New York, and then came back here to your family roots in Jersey City.
Exactly.
So do you know Jersey City Medical Center? Have you been there before you started practice?
No. So before I started practice, I've heard of Jersey City Medical Center. I hadn't really knew much about the new campus. But when I came out here, my father was out here, and so I joined onto the staff and have become very acquainted with Jersey City Medical Center.
So where is your practice located?
So we have offices in Jersey City. We also have offices in Belleville and also in Newark.
And how does one reach your offices? Is there a phone number? You can give a phone number, that's fine.
So the phone number, I actually don't know the phone number.
Don't worry about it. We'll flash it later.
Yeah. Just call and you can make an appointment anytime. There every week.
Yeah, so Jersey City is a very diverse city at this point. It's probably one of the most diverse cities in the country. So who comes to your practice? What problems, issues do you see as a gastroenterologist?
So as a gastroenterologist, we deal with disease of the entire GI tract. So it's the study of the normal function and diseases of the entire gastrointestinal tract, including the esophagus, stomach, small intestine, large intestine, or colon and rectum, pancreas, liver, gallbladder, and bile duct. So really a whole host of organs in the body. And so we deal with all those diseases, and we see all those diseases fairly commonly. Obviously, the most common ones we see are often just colon cancer screening, not necessarily disease, but very important. And then we deal with reflux, heartburn, ulcer disease. Those are fairly common, and then less common but also important diseases like inflammatory bowel disease, any disease of the pancreas, pancreatitis, any liver diseases, which can be common.
So we know a lot at this point about GI diseases, and we know what not to do, so to avoid your offices.
Yeah.
So take us through that a little bit. What are some of the preventive strategies not to be in your office as a patient?
So not to be in my office as a patient in terms of just healthiness. So obviously you want to eat healthy.
And what does that mean? I mean,
so that's a good question. Not entirely clear, but obviously a diet high in rich in fruits and vegetables, high in fiber, tend to decrease some of the diseases that we see with GI. For heartburn per se, you want to avoid spicy foods, greasy foods. Tomatoes can cause problems.
I love
all
tomatoes.
the good stuff. So
no, don't say tomatoes, really?
Yeah.
I thought they were healthy.
They're healthy, but not necessarily. But for heartburn, they can worsen heartburn. Chocolate, alcohol, especially red wine. So
all the good stuff.
Yeah.
And chocolate goes with red wine, so it's just a no-no?
For heartburn, yes.
Okay.
For a glass of wine a day is not a bad thing, but for heartburn it can be a problem. And then honestly, not necessarily for avoiding our office, but for just general health, colon cancer screening is very important.
It's interesting.
And
so here we are with Dr. Spira. We'll be back and we'll talk about colon cancer screening and other services at his office and at the Jersey City Medical Center. We'll be right back.
Good Friend Self-Storage in North Bergen, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunnelly Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self-Storage. Let us be your good friend.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunnelly Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and launch inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunnelly Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net. The Jersey City Medical Center. You know it for its award-winning, life-saving ambulance service. It's also your health hub, with health and wellness locations staffed with certified professionals all through Hudson County. The Jersey City Medical Center, here to help you with your healthy, here when you need us the most. The Jersey City Medical Center. Visit us on the net to learn more. Jersey City Medical Center, Robert Wood Johnson, Barnabas Health Facility. Let's be healthy together.
Newport, the luxury waterfront community on the Hudson River, offers the quality of life you deserve in 10 high-rise rental towers with amenities such as the on-site Newport Path subway, light rail and ferry service, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Sears, JCPenney, Macy's, and Target. Morton Williams Supermarket is just outside your front door. A health and fitness club, spa, skating rink, and medical facilities are also on site. NewportNJ.com. Enjoy the New York skyline from Newport Town Square. Manhattan is just one path stop away or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Want to visit Newport? Stay at the Westin or Marriott Hotel. Go to newportnj.com for details. Newport has luxurious towers, great restaurants, shopping, New York skyline views, schools, playgrounds, a marina and yacht club, gym, spa, fine wine, fine living. It's incredible. It's you. NewportNJ.com. Newport, live like you want.
Welcome back. We're here with Dr. Spira, gastroenterology attending at the Jersey City Medical Center, and truly somebody who has a family history at Jersey City. Dr. Spira, thank you for taking the time. And again, let's talk about the screening processes. Let's talk about detecting disease and what one should be ready for, what are the guidelines, when one should do it, etc. So in the end, one doesn't have to be sick necessarily to see a GI physician.
So I'll talk briefly about why it's so important to get done in the first place. So colon cancer is the second most common cause of cancer death in the U.S. About 50,000 people a year will die from colon cancer. It affects men and women fairly equally, maybe men a little more predominantly, although because women tend to live longer, the actual sort of effect on both is about the same. And you have about a 1 in 5 chance in your lifetime, 1 in 20 chance in your lifetime of developing colon cancer. And so screening is very important. There are lots of screening methods out there, but as a GI, colonoscopy especially is unique in that it both can screen for colon cancer and can prevent colon cancer. So at the time of the colonoscopy, we can take out the lesions, the precancerous lesions that can lead to colon cancer.
So at what age should one start getting colonoscopies?
So if you are average risk, meaning you don't have an extensive family history of colon cancer, at 50. If you are...
And this is men and women?
Men and women at 50. The one caveat to that is if you are a non-Hispanic Black, some people would say start at 45 because there is increased risk in that population.
And so there's a good chunk of Jersey City population that really should start at 45.
Yes.
Okay.
And then depending on the results of that first colonoscopy will determine how frequently you need to be tested in the future.
And so there's a bunch of jokes about the colonoscopy experience out there, and so it doesn't have the most pleasant of reputations.
No.
And so it doesn't sound like it's avoidable. Is there a small pill one can swallow and go into the CAT scan and avoid it entirely? Does that work?
No. And again, there are other methods of screening. CT colonography is one of them, but honestly, that doesn't even avoid what I consider to be the most unpleasant part of the whole process, which is taking the prep beforehand, the stuff you have to drink to clean you out, to make sure to make sure you can see the precancerous lesions, the adenomas or polyps, when we do the procedure.
And so take us through the prep for the colonoscopy. Yes. What should one expect before, I guess, during, and after?
So you should expect fairly detailed instructions from whoever is doing the procedure, which will help you, obviously, the day before, to remember everything that needs to be done. But the day before, you'll most likely be able to eat a light breakfast. Starting at lunch in the afternoon, you'll have to be only on liquids. And then starting that evening, you will take the preparation, which is the liquid you have to drink that will clean you out. Depending on the instructions from your gastroenterologist, they'll have you take everything that evening before you go to bed, or sometimes they will have you drink half, what we call split prep, half that evening, and then half or very early in the morning before the colonoscopy, because you do have to finish drinking everything about at least 3 hours before the procedure. The advantage of doing the split, although it can be a little more difficult, obviously waking up very early in the morning, is that you tend to be cleaner. And the better the view, the better the colonoscopy, the more polyps we can find, the less chance you have of developing colon cancer.
And should you have somebody take you to the colonoscopy?
Yes, so that's the day before. Then the day of the procedure, because you'll most likely be getting anesthesia for the procedure, you won't be able to drive home. So you can't show up to the procedure by yourself, but you need to make sure you have some way of getting home someone to help you get home, because you will not be able to drive after the procedure.
So how do you determine if anesthesia is going to be given to a patient or not?
So for the most part, unless the patient requests no anesthesia, you will be getting anesthesia, and that's for patient comfort. Without the anesthesia, it can be a little bit uncomfortable because we're putting air into the colon that distends the colon or makes it bigger, and people feel that, sort of feel very gassy, and that can be very uncomfortable. But with anesthesia, you don't feel anything, and for the most part, you don't feel anything, and most people don't even remember the procedure. They wake up and say, when are we starting?
That's great. So how quickly do the patients know the results of the colonoscopy?
So pretty much immediately. So once the anesthesia wears off, which is basically right away, so the procedure itself is usually no longer than half an hour, and that's at the top end. You'll wake up pretty much right away, and then the doctor who did the procedure, the gastroenterologist who did the procedure, will be able to tell you what they saw. What they took out, what they saw, what they found. The only thing you won't know is if any polyps are taken out, or you will not know what type of polyp they are 100% until the gastroenterologist gets that information back from the pathologist, and that usually takes a couple days.
And so you mentioned earlier, so just to confirm, so when one has a colonoscopy, there's also treatment, not just diagnosis.
So the great advantage of the colonoscopy is that not only do we detect these precancerous lesions or polyps, it's that we can take them out. So colon cancer is thought to develop in a fairly linear progression from a small polyp or adenoma to a large polyp to a polyp with early changes of cancer or dysplasia, and finally to cancer itself. During colonoscopy, we can find these polyps when they're small and take them out. We can find them when they're large and take them out, and we can also find them when they're very, very early stage colon cancer and take them out, and that can be a cure for colon cancer if it has progressed to that point. And again, these changes take place, we think, over probably a period of at least 10 years, maybe a little bit longer than that.
And so these procedures, colonoscopies, so we do them at the Jersey City Medical Center?
Yes, so we do them at Jersey City Medical Center. We have an endoscopy unit there, a great endoscopy unit with highly trained nurses, highly trained techs, highly trained staff to help out after the procedure. And there are, me included, but a bunch of other gastroenterologists who will do this procedure at Jersey City Medical Center. And we're taking a look at all the high-quality markers of colonoscopy that ensure that you get not just colonoscopy, but a quality colonoscopy. And that includes making sure we're detecting enough of these small polyps, because there is a certain number that you should be detecting to make sure that you're doing a quality procedure.
And so what kind of equipment do we have at our endoscopy suite at the Jersey City Medical Center?
So we have a whole host of the latest equipment and endoscopic equipment. So obviously we have colonoscopes, which are the tools we use to do the procedure, and these are tubes, thin tubes with cameras on the end of it that we insert to be able to look at the whole colon. We also have endoscopes, which are basically the same thing, except we use that to look into the stomach and small intestine when we're looking for ulcer disease or other causes of abdominal pain in patients. And then we have more advanced procedures, scopes for ERCP, which tend to look at the biliary system and can look at the pancreatic duct. And then also we have more advanced even gastroenterologists who also do further procedures like endoscopic ultrasound, which is ultrasound you can do from inside the gastroenterologist.
So when we come back, we'll talk about more advanced procedures at the Jersey City Medical Center. We'll be right back.
Panapinto Properties, Jersey City. Shaping the workplace with state-of-the-art office space and an address your company desires. Building residences that define your home environment. Adjacent to all modes of transportation. On-site parking available. The right address, the right lease. 201-521-9000 or visit on the web at panapintoproperties.com. Panapinto Properties, building Jersey City for everyone.
Rama Jewelers, located in the Lyndhurst Shopping Center at 413 Valley Brook Avenue, Lyndhurst. Come for all your jeweler needs at Rama Jewelers, where you will find a fine selection of necklaces, earrings, rings, and bracelets. Choose from one of our complete sets, our many signature items, or find the perfect engagement ring. Come on down. That's Rama Jewelers at 413 Valley Brook Ave, Lyndhurst. Call 201-939-5784 or visit us online today.
Most women who give birth recover without problems, but any woman can have complications after the birth of a baby. Learn the post-birth warning signs such as fever, headache, chest pain, shortness of breath, increased bleeding, or thoughts of hurting yourself or someone else. Knowing these can save your life or the life of someone that you love. Trust your instincts. If you feel something is wrong, call and get evaluated by your healthcare provider. If your symptoms get worse or you do not hear back from your physician, call 911 or go to the nearest emergency room.
RWJ Barnabas Health. Let's be healthy together.
Welcome back. We're sitting talking with Dr. Spira, gastroenterologist at the Jersey City Medical Center. So, Dr. Spira, at the last segment, we started talking about advanced procedures, advanced equipment available at the medical center.
Yeah.
Talk more about that, please.
So one of the more advanced pieces of equipment we have is something called an endoscopic ultrasound, which is an ultrasound that you're able to do from inside the GI tract, which lets you get a closer look at a lot of the organs in the upper GI tract. Lets you look at pancreas for pancreatic disease, and then in certain cases let you even do more aggressive interventions from inside the GI tract.
So how would you do the interventions?
So that would be a highly trained endoscopist can actually put needles or other instruments through the walls of the GI tract into areas outside the GI tract. Not something we normally do, but we have the equipment available in case it needs to be done.
And so we talked about gastroenterology and colonoscopies and screening for colon cancer. But in our first segment, you talked about gastroenterology as being a specialty for all GI organs. Right. So talk a little bit about disease processes, what people should be aware of as it relates to, let's say, liver disease or pancreatic disease. Talk more about that, please.
So liver disease in particular is another area in this country where we have a significant burden of disease. So there are national recommendations to screen all baby boomers for hepatitis C, which is a virus that affects the liver. And we do that at Jersey City. And hepatitis C over time causes damage to the liver and causes scarring in the liver. And so that can lead to significant disease. In addition, other things that can cause scarring in the liver, especially in this country since we have an obesity epidemic, fat on the liver can cause inflammation, something we call NASH, which is non-alcoholic steatohepatitis, which can lead to scarring on the liver and cirrhosis. And at Jersey City Medical Center, we actually have, so one of the ways of diagnosing cirrhosis is to do a liver biopsy, where we stick a needle from the outside into the liver. But there are new non-invasive ways that have been developed to evaluate people whether they have this scarring, and we have that equipment available at Jersey City also. So we have a fiber scan, which is almost like a special type of ultrasound in a sense, although not exactly, that can be just put a probe on the outside and assess how much scarring there is on the liver.
So we can do a full spectrum of diagnosis in gastroenterology at the Jersey City Medical Center. That's great. Yeah. And so the diversity of the population, what spectrum of disease do you see?
So you see it all. In part of my training, especially when I was at NYU, we had exposure to all spectrum or diversity of patients. You have the NYU hospital, you have the public hospital of Bellevue, and you have the Veterans Hospital, the VA. And obviously in the Bronx, at Montefiore, we have a whole diverse population, and at Jersey City we have a whole diverse population. It brings with it some challenges, but it also brings with it a whole diversity of disease, which is exciting as a gastroenterologist. Keeps you up to date, that keeps you exposed to all aspects of gastroenterology, and it's also something that we can bring in my interactions with the residents at Jersey City, helps teach them and allows me to stay current.
So Talk about that a little bit. So there's a teaching program at the medical center. So what does that do for you as an attending clinician?
I love it. So it's great, obviously, to be able to teach, residents what you know about gastroenterology, but also pique their interest in gastroenterology and sort of recruit new gastroenterologists for the future. And their questions, sometimes you don't know the exact answer to their questions, and it keeps you up to date, makes you not, get stuck in a rut of sort of daily private practice. And it keeps you, again, sort of fresh and up to date and interested in your field.
So the fact that Jersey City Medical Center is a teaching hospital is of great benefit to the patient, because that's the latest, greatest concepts in care.
Yes.
And the latest, greatest science.
I think teaching programs are good for patients. Sometimes they're a little hesitant to be treated by someone who they think as a trainee, but these are not trainees, they're doctors. They've gotten their medical degrees, they're already doctors. And so they're often more invested sometimes in care than someone who is not in training.
So let's transition a little bit. Let's talk about what happens, God forbid, there's a positive result with the colonoscopy.
Yep.
So the patient comes to you with best of hopes, and yet there's a problem.
Yep.
There's cancer detected. What's the next step in your practice? How do you really provide full care to the patient?
So it is definitely a multidisciplinary approach. No specialty in medicine can exist in a vacuum by itself. So we have, because we're at Jersey City, we have access to other specialists, other well-trained world-class specialists who we would then refer care to. And so usually with colon cancer, that entails a combination, or sometimes one or the other, of surgery and chemotherapy oncology. And so we have great oncologists we work at Jersey City, and we have great colorectal or general surgeons we work at, who then we can sort of refer our patients to in confidence that they'll be treated well.
So we provide that full spectrum of intervention and potential cure. And do the patients come back to see you? Do you go see the patients? How does it work to where they don't lose touch?
Yeah, so when they're in the hospital, we'll see them, we'll visit them, even though at that point, unfortunately, there's not much that we can offer, but we can offer them our guidance and our expertise in, in what to expect and what maybe, what we would choose. And then in terms of follow-up, we always have the patients follow up in our office, even if we're not necessarily providing the primary modality of care at that point. Because it's important for the patient to know that they can always come back to us and ask us any questions or get any advice that they need. But also in the future, presuming that their colon cancer can be cured and can be treated, they will need further colonoscopies in the future to make sure that the colon cancer does not come back or a new colon cancer doesn't develop.
Well, that's great to hear. So we provide full spectrum of gastroenterology care, from detection to minimally invasive treatment to surgical intervention, and then we have the follow-up with our gastroenterologists as needed.
Yes.
That's great. So once again, thank you for coming. Thank you for spending time with us. And this has been Dr. Spira, gastroenterology at the Jersey City Medical Center. Thank you.